Hello everyone, I'm Dr. D'Ambrosi from Italy and I'm talking about what to see in methods and results section. Material methods in an academic research should be replicable, repeatable, and robust and follow best practice. Methods should always include a step-by-step description that must be reproducible like a cookbook. There must be present a rationale for experimental design, helpful for complex basic science, and it's important to find the statistical methods. All methods must reflect in results and vice versa. Methods is one of the most important sections of the paper. An error in the methods can be fatal and cannot be fixed. It's important to get advice on methods before you start, if the study is prospective, so before starting the study, or retrospective, so before extracting data. It's important to understand the levels of evidence of the paper. Can be a clinical study, so therapeutic, that is the most common, randomized controlled trial, level 1, that is rare, comparative study, level 2 or 3, prospective versus retrospective, case series, level 4, expert opinion, level 5. It's important to avoid bias in clinical trials and to prevent reporting bias. It's important to use appropriate outcome measures, and these measures must be validated, universal, condition specific, and general health specific, surgeon and patient reported. It's important also the selection, so the allocation, in order to avoid any bias. Treatment group have different prognosis, so apple versus oranges, meniscal repair plus ACL in younger patients versus meniscectomy without ACL in order, and prevent selection bias, so perform mere randomization and strict inclusion and exclusion criteria. It's important also to avoid mistakes in recording, so don't influence the patients, and the patient must complete forms in private, don't influence the physical exam, operating surgeon should not perform assessment, and the patient may want to please the surgeon, so take steps to minimize recording bias. It's important also the follow-up. Patients lost to follow-up, 80% follow-up at 2 years is the gold standard, and performance bias, who performs the procedure. Statistics is one of the most critical sections in the paper. And what are the common mistakes? First of all, there are several possible tests to use to perform a statistics. So in many cases, it's useful for the writers to consult a statistician. And it's important to understand the significance of statistical significance. This is only guide, and statistical significance cannot address clinical relevance. Statistical significance is frequently fragile. So clinical significance is only a guide. Statistical significance is only guide. What it's important for us, it's clinical significance that is more important. And it's important to consider minimal clinical important difference, significant clinical benefits, and patient acceptable symptomatic states. We can see in this figure that there is a statistical significant difference without a clinical significant difference. It's important also to understand the confidence interval, more informative than a p-value. 95% confidence interval gives degree of certainty, and clinically significant difference. Confidence intervals tend not to overlap. Reviewing the statistics, we can call the red flag when there are no difference, and in this case, it's important to check the power analysis. Null hypothesis, so beta error, be alert for red flag, no difference between group. In this case, the methods can be too few patients, too small sample size, not enough statistical power. Results should tell a current story, what happened, what was discovered or confirmed, describing in simple terms what the data show, make reference to statistical analysis, such as significance or goodness of fit, evaluate the trends observed, and explain the significance of the result to wider understanding and critical analysis of the data collected. A result must always be organized parallel to methods. Everything in methods must be reported and vice versa. put the data in tables or figures, and sit table and figures in the text. Tables must be concise summary of a result, group data logically, label columns clearly, provide standalone message, must always include number of patients, mean and confidence interval, define all abbreviation in each table. Thanks for the attention.